Hello, my name is Tristan, and this is a skills video for drawing up insulin. First, I want to look at, make sure I have all my supplies. One is the hand sanitizer, a needle receptacle. I don't have the real needle receptacle, so for the purposes of this video, the water bottle is my needle receptacle. Alcohol, pad, and gauze. Also, my regular insulin, and then my NPH or intermediate insulin, along with my needle, which is a 100 unit needle, and my gloves, and also my patient. The next thing I'm going to do is verify the provider's orders in the EHR, and then I'm going to verify the patient's right, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. Once those are verified, I'm going to compare the provider's orders to the AHR to the MAR. And in the MAR, we have 4 units of insulin that's going to be administered to the patient, and then 8 units of the NPH or intermediate insulin. And as soon as I have those items, the next thing I'm going to do is now I'm going to go into the patient's room, and I'm going to go ahead and introduce myself and explain the process. Hello, Mr. Ramirez. Well, first I'm walking to the patient's room, make sure the door is closed, make sure the patient has proper privacy, make sure I do proper hand hygiene. Hello, Mr. Ramirez. My name is Tristan. I'll be your nurse today. I'm here to administer insulin. Are you allergic to any foods, medications, or any substances? No? Okay, great, thank you. So the insulin that we're going to provide you today is a diabetic management, which helps glucose into the cells to help expand energy. Some of the side effects could be dizziness or nausea. Some of the adverse effects could be severe hypoglycemia, which is very low blood sugar, and potential for hives, which means you're having an allergic reaction. If you're having any of those symptoms, please let me know, and they could be, because they could be more serious. As with any injection, you can feel slight burning or stinging sensation at the injection site, but these should resolve pretty shortly. Also, I checked your blood glucose level, which is at 160, which is an appropriate level to receive insulin. Your next meal will be here in about 30 minutes. We have breakfast for you. So now I'm going to have another nurse come in and verify with me along with the EHR that we are going to verify we need 4 units of regular insulin, 8 units of the NPH or intermediate insulin, which brings us a total of 12 units of insulin. Okay, thank you, nurse, for helping me. Now we'll proceed with drawing up the insulin. I'm going to perform hand hygiene. Then next, I'm going to put my gloves on. Next, I want to put the vials in between in my hands. They come from the refrigerator, so I want to make sure I warm them up. And also, while I'm doing that, I'm going to make sure after I do that, I want to make sure I look at the vials and make sure that they're not expired, and they're not expired. And when I'm warming them up in my hands, I'm also making sure that the solution is mixing as well. The next thing I'm going to do is take an alcohol pad, and I'm going to wipe the tops down, okay? And then while that's drying, what I'm going to do is I'm going to take out my needle, and I'm going to make sure that take my needle out. The next thing I'm going to do is when I take my top off, I'm going to with my top on, I'm going to pull 8 units of air into the tube. okay? And then when I do that, I'm going to take my top off and then put this inside my NPH or intermediate insulin. Not going to drop any medication, just going to go ahead and put the air in. And once that's done, I'm going to take that out. And the next thing I'm going to do is I'm going to drop 4 units of insulin. And then I'm going to put that into my insulin bottle and drop that down here. Put the 4, and then I'm going to invert it. And I'm going to draw up 4 units of insulin. Okay. Not sure if you can see that. And once I do that, what I'm going to do is I'm going to make sure I verify that with the MAR to make sure that I have the right medication that that the provider has requested. Okay. Now the next thing I'm going to do is I'm going to take this and I'm going to put this inside of my insulin bottle, the NPH. Okay. And then I'm not going to put the medication. I'm not going to put the medication in. What I'm going to do is invert it. Sorry, I got the 4 units in there, and I'm going to get 8 units of the NPH intermediate, which will give me a total of 12. Okay. Also, I want to make sure there's no bubbles. Okay, I'm going to pull that out. Okay. And now, since I have that, what I'm going to do is I'm going to use the swoop technique. Okay. And I'm going to put that into my cap. Put the cap into on top of my needle. And now I'm going to verify with the EHR and the MAR to make sure that I have the 4 units of regular insulin along with the 8 units of the NPH or immediate insulin for a total of 12 units. And I'm going to verify that in the EHR with the MAR once more. And now once that's set, what I'm going to do is go ahead and administer that to the patient. Once that's done administering to the patient, I'm going to check to make sure that there's no side effects or adverse effects that are happening right now, and ask the patient if he's okay. And once that's done, what I'm going to do is go ahead, I'm going to make sure I clean things up, put my my needle into the receptacle, and then once that's done, also, if I was to draw this up in front of, if I wasn't at the bedside and I was going to draw this up without seeing the patient, I would make sure I put the patient's identification information there, along with the 4 units of the insulin, regular insulin, along with the 8 units of the NPH and or intermediate insulin, before coming into the room, so the patient's able to see that it's the right and proper medication. Now, once that's done, then I'm going to go ahead, make sure that the patient is comfortable, make sure I get the patient a call light, remove my gloves, then I would go out and then I would document the right patient, I would document inside the EHR the right, what transpired in the room, the right patient, the right drug, the right dose, the right route, the right documentation, the right time, and any of the effects or anything that may have transpired. And then I would go back in the room just to double check to make sure none of the side effects or adverse effects that potentially could have happened, and ask the patient if you need anything or if you have any questions, go ahead and feel free to let me know. And then I would go ahead and I would leave. That's it. Thank you.